Hi, my name is Dr. Tom DiPaolo, physical therapist, of physical therapy and balance in Colonia. We specialize in treating conditions that cause pain, such as jaw pain or TMJ pain, any of the itises like bursitis, arthritis, or tendinitis. We treat tendon and ligament injuries, and we treat pain from motor vehicle accidents or workplace injuries. But we also specialize in the treatment of dizziness and vestibular issues that cause poor balance. And to do that, we have a specific treatment plan for your specific cause of dizziness and poor balance. We use new technology like class 4 lasers and vibration plates. And we also use old technology like electrical stimulation, hot packs, and cold packs. We use a variety of exercises and stretches to help get you through your treatment program, which leads me to some tips for healthy running. If you're recovering from an injury, you can do some static stretching. So basically, you get into a stretch that feels good, hold it for about 30-45 seconds, repeat a couple times on both sides, and that should be good enough for you. If you're just warming up for a race and you're not recovering from any injuries, dynamic stretching is the way to go. To dynamic stretch the hamstrings and the quads, you want to hold on to something for balance and swing that leg forward and backward about 10-15 times, just like that. Do it on both sides. You want to stretch the calves. You can get into a basic runner stretch. Find the spot that feels good and then go back and forth a little bit like that. But you also want to limber up the spine, and that's an easy way to twist, just like this. These will help you stay balanced and avoid injury while you're running. Now, some of you may notice that your balance isn't what it used to be. You also may notice that maybe your parents or your grandparents don't have balance the way they used to be. Some of these balance problems come from neuropathy. Balance problems or balance issues are common in cancer patients, and definitely an issue for our older generation. Some of these balance issues come from concussions or whiplash or inner ear dysfunction and hearing loss. Now, your 8th cranial nerve is what's in charge of hearing, but it also controls your balance. So if anyone has hearing loss, they have damage to that cranial nerve, which means they have a balance problem that we can help with. If you've ever sought treatment for a balance problem, I hope you've had a good result, but if you haven't, you're really not alone. Doctors are very good at finding out why you have a balance dysfunction, but there's really no way that they can treat it unless you get prescribed medications. There's really no other profession like the doctor of physical therapy that can treat you for your balance dysfunction. And there's no better clinic than Physical Therapy and Balance in Colonia. Once you see Physical Colonia, you'll know that we're different from many other offices that treat your balance dysfunction. Balance is a complicated problem. We do a complete and thorough evaluation. We test your hearing, your vision, your proprioception, and your kinesthetic awareness, your strength and endurance, your flexibility, your sensation, and your gait pattern. Remember when I said poor balance also comes from inner ear dysfunction. A common sign of that is nystagmus, and that's a very quick left to right beating of your eyes. It's sometimes hard to pick up. So we use different tools here than other clinics. One of those tools is infrared goggles. These goggles will show a picture of your eyes on the computer screen. That makes it very easy for me to figure out what's going on nystagmus-wise. Now that's on pause, so you won't see the eyes moving. But we also use rails in the ceiling. These rails are pretty heavy duty and can hold up to 500 pounds. So we put patients in these harnesses. They're attached to these lanyards, and the patients can really focus on their balance therapy without having to worry about falling. That's a quick intro about me and Fyzical. Physical therapy is an essential service. We're open. We are only seeing one patient at a time. I'm personally disinfecting everything after each treatment session, and everyone here in the clinic does wear a mask at all times. Now, I want to give you some more tips on healthy running. You want to always make sure that you're slowly increasing your speed and distance over time, especially if you're a new runner. If you're trying to run 5 to 7 times a week, that's too much. You're better off cross-training. You can do some biking, elliptical work, swimming. You don't have to run every day. Also, listen to your body. Don't ignore your pain. If you're running through pain, you're probably going to cause yourself to have an injury. Weak muscles and joint instability equals poor form, and again, going to result in pain. Now, muscle soreness, that's normal. It's not normal to have sharp pain, pain for hours, or pain that's so bad that you can't sleep. If those things are happening, something's wrong. You need to take a break from running, try some cross training, get in the clinic and get some treatment. Another tip is don't zone out while you're running. Don't watch TV on the treadmill. You want to focus on your form, focus on your breathing, and try to avoid any type of injury. You want to change your running shoes often, but if you're going to change your shoes, you need to break them in for at least a week before you do your race. No pain, no limping while you're running. I can't stress that enough. If that's happening, come in for treatment. We can help you get better and get you back on track. For more tips on how we can help, look us up on Facebook or do a Google search for Fyzical Colonia. That's Fyzical. Spelled different because we are different. Good luck in your race. I hope to see you soon.